Welcome, everyone, to Point Taken with Rina Bindi. Today we have Denise O'Malley, who is the founder and Healthy Living Maestro of You Define Wellness. Denise, it is such a pleasure to have you spending some time with me today. Uh, I had never heard of You Define Wellness prior to you and myself connecting, and I believe not only are you an incredibly intelligent entrepreneur, but you've also found a niche in the market that is incredibly underserved. Could you just talk to us for a few minutes about what it is that you do?
Absolutely. And thank you, Rina, for having me on today. I really appreciate the opportunity to chat with you about that which I am very passionate about. So, the long story I won't go into. The short story is I'm a reformed insurance agent and I got really tired with the insurance industry. And after a couple of decades of doing employee benefit enrollment meetings, I decided to launch a company that did that which my clients had been asking me for 2 decades. And that is an employee benefit program that covers those things not covered by traditional medical insurance.
That's incredible. So how did you decide to put this together? I mean, was it just like, how did you decide to put this together?
Well, it's not a new idea, judging by the hundreds of
Mhm.
healthy living professionals that I've spoken with over the past couple of years. They all had wanted something like this. Some of them even tried getting in and putting something together, but they got lost in the weeds. And the fact of the matter is, I happen to have the skills and experience. For the 10 years before I launched You Define Wellness, and I've been in the insurance industry for, well, 2021 will be my 40th year in the insurance industry, believe it or not.
Oh.
I started at the age of 3. Okay. What I like to believe. But after the 10 years before launching You Define Wellness, I had been the national sales director and a consultant to optometric owned vision plans, an employee benefit plan owned by optometrists. And as number 2 in the company, I knew how to do everything in it. I knew how to create a product. I knew how to price a product. I knew how to build the claims and administration platform, recruit providers, and get it launched in the marketplace. So it was a natural fit for me. But the truth is, my husband's a massage therapist, and I was working at the front desk at his office weekends and nights, thinking that my next step in my career would be to run his own private practice. And I kept hearing clients say that they wanted the monthly membership that was offered, but they didn't want to pay for it out of their checking account or on their credit card. If it was taken out of their paychecks, they'd do it in a heartbeat.
Mm.
I knew how to do it. So I put together a business plan and it ended up getting put on the shelf for a couple of years. But when I left the insurance industry, it was, hey, let's take this off the shelf and let's see if we can make it work. That's the
That's
story.
that's brilliant, and it is definitely working with the hundreds of providers that you have in this You Define Wellness network, and not to mention the thousands of employers that are providing this as a service to their employees. You and I were briefly discussing how society has been trained for sickness care rather than
Oh, yeah.
wellness care. Would you like to share a little bit about how this has been affecting us as a whole?
This is where I get on my soapbox. Um, Having been in the insurance industry for so many years, I have an understanding of how medical insurance works. I understand the history of how medical insurance works. And actually, my great 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 grandfather had something to do with that a million years ago, but we won't go into that story. Just know there's another one there. But over the course of my career, I, health insurance has saved me. I can't tell you how many times when I've been sick, I needed to use it. But what we've done as a society, and especially with employee benefits, is that we have trained individuals that if something is wrong with you, the first place you turn is your medical insurance plan. Go get a claim, go file a claim somewhere, go to this doctor, get this prescription. And the fact of the matter is, I personally have had a couple of instances, a number of instances where traditional Western medicine really failed me. And it's not to
Mm.
say it's bad because it's definitely there and it's there for a purpose. But I would go to a doctor who didn't understand what I was saying and they'd pull out the white prescription pad and try this. not knowing if it'll work. Or they say, what you're telling me is not true. That's not a real disease like hypoglycemia, or something going on and my fingernails are lifting and I'm having doctors telling me stop sticking things underneath my fingernails. Hello. And it wasn't until I would step out of that traditional model and go seek care that I'm having to pay for out of my pocket because it's not covered by medical insurance that I actually found some solutions. So, my whole soapbox is, number one, Western medicine, as we know it today, needs to do a much better job understanding the other modalities, that it is a big picture. And the fact of the matter is, Western medicine is the new medicine. There are other treatment options that have been around that are ancient or have been explored through herbs and essential oils or movement. And it needs to be all combined together. And there is some education in the medical schools on some of this, but it's health insurance is sickness insurance. It's there for when you're sick and you need it, but it's not the answer to everything. When I say also that we've trained people to go to it, there are a lot of people who think going to the dermatologist costs $20 because that's what we've taught them. You just pay your copayment. You don't know that the actual visit at the dermatologist's office is maybe $450 because insurance is picking up the bulk of it. So when you suggest alternative options, the first response people will say is, well, I've got to go fill up my deductible for the year. I've got to cram in all this stuff, or I need to go over here because I can't afford an alternative course of treatment. Even though it may be less invasive, perhaps it'll help you get whole body health versus let's just fix this symptom that you have, where whole body health is getting to the root cause of everything. So yeah, it's a soapbox I get on a lot.
It's an easy one to get to, and it's hard to necessarily, well, not even hard to imagine, but when we've grown up, we've been raised in this Western medicine, in this culture, in this environment our whole entire lives. So when the things like the chiropractors or acupuncturists or even wellness coaches, nutritionalists come into play, and they are doing their best to say, hey, look, we were around before the pill, like herbs, plants, anti-inflammatory, natural remedies for anti-inflammatories, like just through vegetables and intake that can be taken. Like most people are like, oh, that's like, woo woo, hocus pocus kind of stuff. Like, no, it's not. It's like, it's not.
It's deeper than that, though. There are a lot of people who don't know there are other options because they've never stepped foot outside of their medical insurance at all because of all of this. So maybe they've seen something on Facebook or they heard somebody did something, and so maybe they'll venture out. But it wasn't until I walked away from the world of insurance 5 years ago that I actually learned about, I didn't know there were this many modalities out there, the different types of things you could do. I'd not ever been exposed to it before. And I keep meeting people literally almost every single day that it's like, man, where were you 10 years ago? Where were you 15 years ago? I didn't know this was an option for me. From life coaching, when for most of my career, I didn't like what I did. I didn't know my path. I didn't have my purpose or my it, and I didn't know what it was. I didn't know that there were people called life coaches, and I was an executive of a company. It wasn't like I was, not exposed to a lot of different things. I didn't mean that in a negative way, but here I'm this reasonably intelligent woman who had no idea this stuff was out there because I wasn't exposed to it. So at least, if nothing else, if we can expose employees in a workplace to all of these different things, they can see that, oh my gosh, this might be something I want to explore. And that's kind of the passion that I want, is to help people find the path that's right for them.
And when it's a passion, it doesn't really feel like work, even when you're putting in 16-hour days.
And I do all the time. And I had somebody just yesterday say, okay, Denise, you need to find balance. Yeah, I think we all do. And I'm guilty of that as well. But when you love what you're doing and you're just wanting to get it out there in the world, a 16-hour day doesn't feel like a 16-hour day.
I understand 100 hours a week sometimes. Totally, totally in sync with you there. But
Yeah.
it's fun, and it's nice to educate people and to do things that we're incredibly passionate about. For me personally, when it comes to holistic healthcare and alternative medicines, I didn't know anything about
Mhm.
holistic healthcare. I'm like a Kaiser Permanente baby.
Oh,
My
yeah.
mom worked human resources for over 30 years with Kaiser
Yeah.
Permanente. She was the head of regional. She was like really high up. So whenever there was a problem, I just walk into Kaiser
Yep.
and I was taken care of, like with pills, with medicines. And
Hmm.
I did get addicted to pills when I was in middle school,
Oh,
even
boy.
as a result of that, when all I really needed was probably a life coach. Stepping into teenage years shortly after and having the inability to have the coping skills that I needed to express myself, to be able to discuss what I was feeling or experiencing, or to even to ask for help. It was really difficult for me to ask for help and say, I need help with something, because there was shame associated behind that for me when I was growing up. And as a result, I became addicted to the pharmaceuticals at a really young age. And if I had known about this sooner, it might have been different, but everything happens when it's supposed to. So I
Right.
was running one day. Well, it wasn't the first time I had been running, but I was running and I had extra weight on me. And when I went up this hill, step forward with my right foot, sciatica pain shooting all the way down to the foot, crumpled to the ground. And I had two neurosurgeons who were residents that I was living with at the time. And one of them was like trying to massage my butt, trying to like, it's got to be something in there. And she didn't know about chiropractic care. And we didn't know it was a sciatica issue. And after one of my other girlfriends was like, you should go see a chiropractor, I was like, I think I've heard of a chiropractor. I have no idea what they do, but if you're saying it'll fix my butt, I am willing to go see this chiropractor. And that opened up my whole entire world
Yes.
to so much more.
Yeah. Yeah. I want to unpack what you said. You said two really important things. Number one, you knew something was wrong, but you didn't know what it was. This was before the injury took place. That's one of the things that I am on my soapbox about, is that there are so many people that are floundering around. They know something's wrong, but they don't know what, and they don't know how to ask to say, okay, I feel like going insane or something, that I'm the only one who probably feels this way. No, you're not. You're probably one of millions that feel the exact same way, but it hasn't been voiced before. So we have systems that we've put in place to help you find that voice, to help dial into, okay, is this bothering you? What's going on in your life? And that's through an assessment, a well-being assessment that we've just recently created and we're launching. The other component of it is the education about what different modalities are, like chiropractic. There are a lot who don't know what it is. I've been using chiropractic. My kids came home from the hospital and stopped by at the chiropractor's office on their way home to give them an adjustment. And, I have adult children now, so it's been a part of my life for a long, long time. And my first time I went was because there was a sign outside of the chiropractor's office that says, are you sick and tired of being sick and tired? And I was. And so it prompted me to go for the chiropractic. But that's the other component of it, is how do you learn about these different modalities? And that's one of the reasons why we have so much education on our website. And we're building a video dictionary so that you can go and watch a video on what is life coaching, what is chiropractic, to help you, the consumer, understand those different things. So I'm so glad you shared that story. It's perfect. And I don't want to mislead anyone here that nobody ever does this. There's actually a statistic that came out. It was a report in 2012 by the National Center for Complementary and Integrative Health, which is, I believe, part of the National Institute for Health. And they found that there were 59 million Americans spending $30.2 billion a year. This is 8 years ago.
Whoa.
On those things not covered by medical insurance. This was stuff they were
Wow.
paying for out of their pocket. So obviously people believe in it. And this does include supplements, which has very high usage, particularly if you're picking them up off the grocery store shelf, as so many people do. And then they say they're taking supplements. Please don't do that. Let me just say that right now. Please don't do that.
Fillers.
We have some people who, talk to an expert first as to what you need. But so people are obviously seeing the value, or they'll go get a massage. And so many of them think that it's just, it's to pamper you. No, I'm married to a massage therapist. It's about the healing. It's therapeutic. And so they already believe in it. And now we're trying to work to get employers to support it and see that it's a huge part of their total integrative health plan for their employees.
I'm glad you mentioned that about employers to help educate their employees. Can you tell me a little bit more about how You Define Wellness works with employers?
Absolutely. We have employers who just want to do it themselves, and we have a la carte programs where they can choose a wellness education talk when they feel that they need, somebody to come in and talk to their employees and check off that box called wellness. But really, the approach that we want to take is let us be a partner with you. There are a couple of reasons for it. Number one, if an employer is unhappy with their medical insurance premiums, there's only one way to reduce medical insurance premiums, and that's to reduce medical claims costs. On a small group plan, it's probably not going to have a huge impact because you're rated in a group with everyone else out there. But if an employer has a self-funded plan where they're actually paying the medical claim costs, they need a wellness component to it that's integrative and comprehensive and can help them out. But the big reason that I talk to employers about is we do things every single day in business to mitigate our risks. We have business liability insurance, we have policies, procedures, we have training, we have all kinds of things. Well, there's people risk management too. And that's what a wellness program can do. It can help with employee turnover, unplanned absences, dissatisfied clients. I had a statistic that I just saw not long ago that for every dissatisfied client that goes away, the revenue attributed to them, you can multiply it by 20 or 50 as to what the actual impact to your bottom line.
Wow.
And you think about it, you're unhappy with someone, you put it on social media, right? So it makes sense. So we can work with an employer, but everything starts with that individual well-being assessment. We have a new program we created called Pathways, and this is an integral part of it, where 4 times a year, employee can meet with a wellness pathfinder. This is someone who's gone through a certification program we created that can help them take a look at a snapshot of their life, take an assessment, and then help them on their path, and then meet with them 3 times, other times during the year to make sure they're on their path. We bring in wellness sessions. When I say bring in, that's the wrong words because it makes you think that I'm bringing in a massage chair. That's not what's happening. The employee can choose a wellness service from our network of providers, any service that they want, from traditional to new age and a little esoteric.
So could you maybe name off a few of those different types, just
Sure.
because that's very broad?
It is very broad. We have everything from A to Z, from acupuncture to Zumba lessons. Let's just say that. Actually, I don't have Zumba lessons, but I'll go get them if somebody wants them. So acupuncture and chiropractic, and we have health coaches and people who will work with you on your nutrition, and personal trainers and fitness, to mental health and relationships and coaching and counseling and occupational. And we even have energy healers, Reiki practitioners, healing touch. We have Akashic record readings, and all of this is in the new age category because if it reduces your stress level, that's wellness. And we encourage that they do this every single month and go get a service, because wellness isn't wellness if it's not being done on a regular basis. So we don't slap something together. So between the well-being assessment, the individual services, and then we bring in group wellness education. And this is where the employer can somewhat dictate the tone of their wellness program by the programs that they're selecting. And they have a little bit more
I
control.
love that you said it's amazing. This whole program is amazing. I'm just, I've told you, I'm fascinated with what it is that you've put together. And so let's say I didn't know anything about holistic healthcare
Yeah.
or anything. For me as an employee, it would be a big door opener for me because
Yes.
I'd say my boss or my CEO or president cares enough about me to provide this. And then it would be about me getting out of my comfort zone and gaining the trust in the types of services that were being provided afterwards and being exposed to all of
Yeah.
these different services. You were so right earlier when you said getting a massage isn't just something for being pampered with. It's an actual healing touch. My husband and I both go get massages regularly, at
Mm-hmm.
least once a month. He would have one in-house every day if he could. We have a huge, like a luxury massage chair.
Mm-hmm.
Even it is so important in the value of being able to have somebody find the areas of our body, and whether it's relaxation, shiatsu, pressure massages, sports
Mm-hmm.
injury massages. That's my massage therapist. She comes in and I love it. She'll stretch me out. She'll
Yeah.
help me with my tendinitis, sciatica, if it ever
Mm-hmm.
flares up.
Yeah.
She
There is
gets
an
on
added
me.
benefit right now with this pandemic that we are in, is
Mm-hmm.
that for my husband, some of his clients, this is the only touch they're getting.
Oh my gosh. That is so true.
Mm-hmm. Yeah.
People need touch.
They need the touch. And so it's not just healing the body physically, it's healing them spiritually and emotionally. And this is it's he gave me a massage on our second date. And the reason why he did is because I'd never had a massage in my life. And he wanted me to understand what it was. So he taught me, he was the very first person to teach me about an alternative healing method, and that it was
Wow.
not the preconception that you might have. You had to experience it. And that's,
Mhm.
that goes with everything that we have.
That is so true. Wow. No wonder you married him.
The massage was good. In fact, I told him, I said, "Oh my gosh, felt fantastic. It was great." And he says, "Well, how would you know? You've never had one before."
Oh man. Like just take the compliment, buddy.
That's just his personality. He's always a
Uh-huh.
joker. But yeah, it's, all of this is just really important at this period point in time, everything that's going on.
I love that you have the employers providing this for their employees, because a lot of people we kind of touched on earlier don't know what's out there. So for
Yeah.
employers to be taking charge and taking control and helping the people that are there, supporting them and supporting their businesses is just instrumental.
This new program is called Pathways. It's a
Mhm.
multi-dimensional wellness at work option, and it will debut January 1, 2021. That's the target date. We have retired our previous employee benefit plan because it didn't have enough in it. We wanted to make it more robust. We wanted to add these well-being assessments. We wanted to add the one-on-one coaching with one of our wellness pathfinders. We wanted to add wellness fairs. We wanted to just pack it with everything that is really needed for the workplace. So this is actually the beginning of this new launch, and we're really excited about it. There's nothing like it on the marketplace, so I'm really excited about it.
Oh, Pathway sounds phenomenal. I can't wait to learn even more about it and see what's going on behind the scenes. I love education and I love learning. I love everything You Define Wellness is doing. I do have a question about employers and
Sure.
how they would get started, or what the
Okay.
first step would be for them to go through this process.
hmm First step is to go to our website at you, as in YOU, definewellness.com. Take a look at our different product offerings. The homepage will wander you through some of the different things that we offer as solutions in the workplace. And then I would go over and visit our wellness center. It's one of our menu options, and see everything that we have in our wellness center. The wellness center is not a physical location, it's actually a resource center. So everything regarding our providers are there, from videos to articles to downloads, free initial consultations, and more. And then wander over to the Contact Us tab and reach out. That is the best way to get started. There will be an option, I'm sure, if an employer just wanted to jump in and do it. We're actually looking at that. That's the last part of our website that has to be built. But I would really rather have the consultation with the employer to make sure that we're going to be meeting their goals.
Excellent. And how many states are you in currently? I heard you guys are going to be expanding very soon as well.
I've lost track. We are coast to coast. We have providers from California to Maryland and from Wisconsin down to Arizona. So
Amazing.
we're all over the United States. Almost everything is being done with virtual services, which is why we can go nationwide with no problems. We are not an insurance program. I need to make sure I point that out. We are not insurance, nor are we a replacement for medical insurance. When we go into an area, so we have an employer in Wichita, Kansas that put us in place. They have some employees there. What we will do is we will survey the staff to find out what hands-on services they receive in their community. Who's your chiropractor? Who's your acupuncturist? Who's your massage therapist? And if they meet our criteria for joining our network, we will extend an offer to those people to join our network so that they can continue servicing the employees of that company. So that's how we grow nationwide with our network, is to be able to build within it. And there are those who are like, well, wait, I don't want to wait until you build it. It doesn't take long. I did it for 10 years very successfully. It's not a difficult process. We know how to do it.
Yeah, you do. I mean, the growth that your business has been experiencing has been rapid, like
Yes.
especially during the pandemic period where these services are needed and crucial in our everyday life and everyday routine. And I feel people are looking for that something. People are looking for, ways to help better themselves, especially with, the loss of life that we've had, and with illness being on the uprise due to COVID in particular.
Yeah. One of the things that went on during the pandemic, early on, I put out something on Facebook, and I love it. And when I can put something on Facebook, and I get a lot of responses, so we have great engagement on our Facebook pages. But I put something out there and I said, I've got to ask, this is something that is affecting every single person in the world, unless you live somewhere on a remote mountain and you have no idea what's going on. How do the healers help others when they're feeling the exact same things? And their responses were mind-blowing to me. And they really relied on their training and their education to be able to work through it and help other people, and it helped them heal. But one of the things that we found in the corporate world was those who make the decisions on programs like ours, they were frozen, and yet their employees were turning to them for help, but they didn't know how to help them because they're dealing with the exact same things. It was something that nobody has ever experienced, and they're starting to thaw out. And I saw that when they started talking about their own self-care needs on social media. So we've been able to reach out to a lot of them and share with them our website as resources. And so I feel good about what we were able to do during the shutdowns. And, we're not done yet, but we have gotten the word out there that we have the resources available, and the hits on our website went up substantially.
That's good. People are wanting to take control and take action of their life, and they're finding you, and that's what's important.
That's it. We are organic in growth, and that we do not have the deep pockets of those insurance companies. And so it's all been by word of mouth and social media. And it's been amazing the number of people that we've connected with, because someone will say, hey, you've got to go hear what these guys are doing. We're doing it the right way. We're the two most important people are the person giving the care and the person receiving the care. We are nothing but the conduit to help make it happen.
That's part of the reason why I wanted to have you on as a guest, simply because it is word of mouth. It is the education process. And when someone, like for me, when I was first introduced to You Define Wellness, I kind of read the website. I was like, I think I understand, but I didn't really understand. And so I went ahead and had a couple of conversations. I'm like, oh my goodness, this is a whole nother level.
Well, and the reason why you didn't understand is because nobody else is doing what we're doing.
Mm-hmm.
So when it's the first time you've ever seen it, it is what? And then it's, this makes sense. And why hasn't this been here before?
Well, congratulations on
Thank you.
spearheading this. Just life in itself for the human population.
Yeah.
And I know the education process is difficult, especially with something new, something that people have never seen before or heard of before. A lot of minds are like, oh, no. And other minds are like, oh, I totally get it. But it's the connection in between with them needing the material and seeing it a few times before it starts to sink in. I know for me, when it comes to even with digital marketing, I can hear or read or do an exercise 5 or 6 times and think I have a complete understanding of it. And then someone else will come in and educate me in a whole different way on the exact same topic. And I'm like, whoa.
Yeah.
My mind was just exponentially expanded. Thank you. Like, it's crazy how much meaning or thought can really be behind one business or one sentence or one action. It's all open to interpretation.
I love hearing people describe our company. I love it when they're introducing me and they're trying to describe it. I want to hear what other people's perceptions are. And there are some who have made it over complex. And we are extremely complex. If you look at the business structure, the complexity is huge because this is not a simple thing that we've put together, except there's 3 things that we do and only 3 things. For the consumer, it's education and affordable access to the services of their choice. For the independent health and wellness professional, it's providing them with support and connection and collaboration and community. That's it. That's all we're doing.
And you're doing it well.
Thank you.
Well, Denise, is there anything else that you'd like to share with us before we wrap it up here? We're almost out of time.
Nothing except for those who are watching this, go to our website. Take a look at it. Let us know what you think. The other component of that is there's something that you think that we should have that we don't have. We listen. We're creating this as we go along. And so contact us.
I love the entrepreneur in you. So amazing.
It is fun. It's a lot of fun.
Mm-hmm. Well, you can find Denise O'Malley on LinkedIn, Facebook. Do you have an Instagram?
I do have an Instagram, but I don't check it very often.
That's okay. People can follow you on Instagram. Do you have a Twitter feed?
Oh my goodness, yes.
People can follow you on Twitter.
And follow me personally, because that's where all the action is. You Define Wellness has a Twitter page, but follow me at YDW Maestro. That is easier to say than actual.
I love following you on LinkedIn personally, because you post so much valuable information, articles about things that are coming up, not things, but education seminars or what it is that You Define Wellness is doing. And I have found a lot of value simply through your LinkedIn profile, to be honest. Yes. Well, my dear, thank you once again for being on today, and we will talk again very soon.
Thank you.